Imagine taking a medication that could reduce your risk of heart disease, osteoporosis, even cognitive decline, and still feeling like you're doing something wrong. That's the case with hormone replacement therapy, or HRT, for millions of women. But what if most of what we think we know about estrogen is wrong? Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. And that's exactly what I'm here to give you today. Let's talk about estrogen and menopause, because the misconceptions out there are not only outdated, they're impacting women's health in a big way. Here's a shocker. The average woman spends more than a third of her life in menopause. That's a long time to struggle with things like hot flashes, night sweats, anxiety, brain fog, sleep disturbances, and more. I hear from women every week who say they feel like a stranger in their own body. I remember one story in particular, Laura, a 52-year-old teacher. She thought she was developing early onset dementia because she couldn't remember the names of students she'd taught for years. Turns out, her estrogen levels had plummeted and brought on severe brain fog. Within a month of starting HRT, she said, "I feel like I got my brain back." But despite so many success stories, HRT is still surrounded by fear, mostly because of a major study published back in 2002 suggesting estrogen increased the risk of breast cancer and heart disease. What didn't make the headlines? That the women in that study were much older than the average woman starting HRT, and the actual risk increase was overblown and later corrected. In fact, newer research shows that, for many women between ages 45 and 60, estrogen actually reduces the risk of heart disease, helps preserve bone density, protects brain function, and can dramatically improve quality of life. Estrogen alone, especially for women without a uterus, may even reduce the risk of breast cancer. And let's not forget, heart disease is the #1 killer of women, not breast cancer. Yet fear continues to be disproportionately placed on HRT rather than the true health threats many women face. So if you're dealing with menopausal symptoms, know this: suffering through it isn't some kind of badge of honor. You wouldn't go without insulin if you had diabetes, and you don't have to go without support during menopause either. That includes options like lower-dose estrogen therapy, vaginal estrogen for local symptoms, and even non-hormonal remedies like cognitive behavioral therapy for sleep or cooling aids for hot flashes. For those who prefer to start small, home remedies like dressing and breathable fabrics, keeping your bedroom cool, or regular exercise, especially strength or resistance training, can help ease symptoms. One method gaining popularity? Rucking. That's walking with a weighted vest, which has evidence-backed benefits for cardiovascular and bone health, especially helpful during and after menopause. Remember, though, HRT isn't right for everyone. If you have a history of blood clots or certain hormone-sensitive cancers, it's vital to talk to a doctor who's informed and open-minded. Too many women are told no without a real conversation about their options. Worried about your own health? Start by checking in with the UB Symptom Checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket. Always 100% free. And if this video helped you feel more informed and more empowered, please like, subscribe, and follow for more doctor-approved info you can trust from UB Health. You deserve answers you can trust, and we're here to give them.